Hi, I'm Chad Ducker, and I am performing my physical assessment. Um, I'm going to begin by washing my hands, providing for privacy, and explaining the procedure to the patient, and then draping the patient. Um, we've also already completed the general survey. The patient is 5'6". He's 180 pounds. His vital signs are all within normal limits. His dressed in his work clothes. His appearance is clean and well groomed. His mood is happy and pleasant, and his we also assessed his gait, and it was very smooth and normal. Then we're going to go to his skin, which is white and appears to be clean. It is warm and dry, and my mind just went blank. There is no edema, lesions, or masses noted. Then I'm going to take a look at his nails. His skin turgor. Let me do that first. It's good. All right, and then we're going to look at his nails. If I can see your hand real quick. His nails are smooth and rounded, no lesions, and his cap refill is definitely less than 3 seconds. All right, I'm going to start with the cranial nerves and then go on to the rest of my assessment. Cranial nerve 1, olfactory. I'm going to check his nose. All right, if you can breathe in and out for me. And breathe in and out for me. All right, both nostrils are patent. If you can tell me what this smells like.
Rubbing alcohol?
Yes. All right. Cranial nerve 1, olfactory intact. 2, optic. We performed the Snellen test before we began the procedure. It was within normal limits with his contacts in. All right, and if you can follow my finger. Then we would do that with both eyes. And cranial nerve 2 is intact. Cranial nerves 3, 4, and 6. Oculomotor, trochlear, and abducens. His pupils are straight again. Pupils are clear, equal, and reactive to light. And all right, if you can just follow this. Okay, 3, 4, and 6 intact. Cranial nerve 5, trigeminal. Can you clench your teeth? All right, and back down. Okay, and if you can close your eyes for me and tell me when you feel this.
Now. Now. Now.
Okay. Cranial nerve 6 intact, or 5 intact. Cranial nerve 7, facial. Can you smile and frown? All right, and stick out your tongue. And close your eyes. And then open your eyes and lift your eyebrows. All right, and puff your cheeks. All right, cranial nerve 7 intact. Cranial nerve 8 acoustic. I'm going to whisper into your ear, and you tell me what I say.
Football? Baseball.
All right. Acoustic intact. 9 and 10, glossopharyngeal and vagus. Can you open your mouth for me and say ah? And stick out your tongue and say ah. Okay, uvula is midline, and it rises. And I will not check him for this, but I do know that his gag reflex is intact. And then cranial nerve 11, spinal accessory. If you can Rotate your head against my hand. Okay, other side. And then lift your shoulders up. All right. 11 intact. 12 is hypoglossal. And stick out your tongue. No tremors noted. Repeat after me. Light, tight, dynamite.
Light, tight, dynamite.
Perfect. 12 is intact. We're gonna start with his head and go down. His head is well rounded. His hair is evenly distributed and thick, and his scalp is clean without lesions or scales. Trying to think. His hair is equal also on his arms and legs, his eyebrows, and his eyelashes. All right, then we're going to go to the ears. I do not have an otoscope, but looking at his ears are equal in size and shape. And do you have any pain or tenderness?
No.
Okay. And no swelling or redness or discharge noted. And then we would also look inside the ear. We would expect the tympanic membrane to be a pearly gray. And then we would also look for the cone of light reflex at 5 o'clock in the right ear and at 7 o'clock in the left ear. Did I get that right or did I get it backwards? And then we're going to look at his eyes. And I just, yep, there it is. All right. And his eyes are brown. The sclera is clear. And no drooping of his eyelids. His conjunctiva is white. There's no redness. And his lashes are evenly distributed. His nose is midline. I don't notice any flaring or any deviations of his septum. And then I'm going to palpate his sinuses. Tell me if you have any pain. Any pain or pressure?
No.
Okay. And then look inside your nose. His mucosa is pink and moist, and his terminates are clear. And then his mouth, his lips are symmetrical and pink without cracks. And if you can show me your teeth, go ahead and then open your mouth. No malocclusions noted, no overbite. Let's see, let's look inside here. Okay, now open your mouth. I would also put on gloves at this time. His mucosa is pink, moist. We would also check for the palate to make sure there are no masses or lesions. And his tongue, his uvula is midline, his tongue is pink without cracks. And, all right, and then his neck, his trachea appears to be midline. I don't notice any swelling of his carotid artery. Let's see, behind you real quick. Oh, wait, let's do range of motion first. Can you turn your head from side to side? And then up and down? Okay, and then side to side this way. Good, okay. All right, now if you can swallow for me. Good, swallows midline. I was unable to palpate his thyroid gland. And then we're going to start with the lymph nodes. Let's see here. submental, and we would do this on both sides. Submental, and then submandibular, and preocular, and posterior ocular, and occipital, and then jugulo, and then superficial clavicular, and then the deep cervical chain, and then posterior cervical, and then the supraclavicular. None of which were able to palpate. When we checked his vital signs, his respirations were 20. He is not a smoker. He has no history of asthma. He has, we checked for use of the accessory muscles in breathing, which he does not have, and he reports no cough, shortness of breath, or pain. His chest appears to be symmetric, and alright, if you can just lean forward for me for just a few minutes. If we were doing this on a patient at home, we would do it without their shirt on. Alright, and deep breath. Good, and let's check the other side. Good, equal expansion of the chest. And we're going to check for tactile fremitus. Alright, just a tad bit there you go. And then say 99 every time you feel me touch you somewhere.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Alright. And vibrations were felt. All this good there. Alright, now I'm just going to palpate for any tenderness, pain. Any at all?
Yeah.
Okay. And, excuse me. After we palpate, we want to percuss, which you probably won't be able to hear because I'm not very good at, but you would start on the back. Well, let me show you on the front first. Start on the front, you'll go from here and then here, and you'll go all the way down the front and also on the back, checking for equal on both sides. And on the front. Oh, I actually got a little bit on that. All right. And then we are going to listen. And deep breath. And I won't make him do that the whole time, but I will show you where we would listen. So after here, we go here. Right, and same thing on the back. Start on one side and go to the other. All right. And then his breath sounds are clear and equal, and no wheezing or crackles or anything noted. Then for heart. All right. You would check for heaves, and you would ask about pain or discomfort. Then you would look for distension of the carotid artery, which I do not see any, and both sides. And then you would palpate for thrills or vibrations. None noted, but I did feel his heartbeat at the apex. And then you would auscultate for in the aortic, pulmonic, herbs, tricuspid, mitral, and apex. And you would ensure that the pulses were equal and S1 and S2 were heard. All right, S1, S2 equal, no murmur noted, and no additional heart sounds noted. Then you would move to the abdomen. You would ensure that the umbilicus was midline, stomach was rounded, and there was no lesions or masses noted. You would listen first to the abdomen. And then vowel sounds were active in all four quadrants. After you listen, then you'll percuss all four quadrants. And they should be tympanic. You should not note dullness unless you are over the kidneys or the liver. You would then palpate. You would check for kidneys, liver, and spleen, as well as abdominal masses. And any pain?
Nope.
Nope, and no swelling either. I also am going to point this out just because I just noticed this. I'm actually on his left-hand side, but on this video, I guess because it's computer, it looks like I'm on his right-hand side. So I am listening to the correct side of the heart. And then after, you would also at this time palpate for distension of the bladder, and none was noted. And then you would also check the inguinal lymph nodes at that time. All right, and if you can, I'm going to look at his joints. If you can put your leg down for me real quick. All right, and if you can see your arm. Yeah, and then your knee. And no swelling or edema noted, some mild crepitus in his right knee, but none in his other joints. Do you have any pain or any of your joints?
Nope.
Okay, excellent. And then if you can just lean forward a little bit, again, you would have the patient's shirt off, and you would check for midline spine without curvature, and ensure that it was straight. Okay, and if you can stand up for me. All right, and if you can turn from side to side, just have range of motion of the spine, and then touch your toes. Excellent. Okay, and then all right, with your arms flat, if you can raise your arms above your head. All right, and then back down. All right, and then bring your arms forward, and then over, and then bend your arms up. All right, and then turn them down to your side like this. Perfect. All right, and you can sit down. If you can bring one of your legs out straight, and flex your foot, and then extend your foot. Okay, and then bend your knee. Okay, and then you would also do that to the other leg. And then you would also check the hips. All right. As I said earlier, we had already assessed his gait. And all right, if you can stand up for me, and stand on one foot. All right, and then switch legs. All right, and then if you can take the toe of your foot and put it behind your other leg, and then bring it down. Okay, and then do that with your other leg. Okay, and then close your eyes and touch your nose. Okay, and you can sit back down. And then we are going to check sensory. And I'm going to start with the sharp and then the dull end of this pencil. And can you feel this?
Yes. Yes. Yes.
Okay, and then the dull.
Yes. Yes. Yes.
Yeah, and now I'm going to take these 2 points and tell me when. Can you feel these 2?
Yes.
Yeah, tell me when that feeling becomes 1 feeling instead of 2.
One.
Okay, so that is about his 2-point discrimination is about 1 centimeter apart. I would also check reflexes at this time, but I do not have a hammer. And then you would also want to inspect the breast. You would inspect for color, shape, symmetry, discharge, any lesions or masses. You would ask about pain, and then you would palpate the breast by having them raise their arms above their head, and then you would start in a circular motion from the inside out and feeling for any masses or knots or pain or tenderness. Noting that if you note any masses, you would also note the size and shape of that mass. And I believe that is it. Thank you.